You are going to have a tooth pulled. There is no injection. There is no gas. There is no countdown from 10 while the world blurs gently away. There is just a man with a pair of iron forceps and the instruction to sit still. This was the reality of surgery for almost all of human history. Before 1846, there was no such thing as general anesthesia. If a surgeon needed to cut into you, you were awake for every second of it. The question is, what did they actually do? The honest answer is, they worked fast. Speed was the only mercy available. A good surgeon in the early 19th century was measured not by precision, but by time. Robert Liston, an Edinburgh surgeon operating in London in the 1840s, was the fastest in Europe. He could amputate a leg at the thigh in under 30 seconds. Witnesses timed him with pocket watches. He was so fast that during one operation, in his haste, he amputated the fingers of his own surgical assistant and sliced through the coat of a spectator nearby. All three developed infections. 2 of them died. The patient also died. It is the only operation in recorded history with a 300% mortality rate. Speed helped. It did not help enough. The other option was alcohol. Patients drank heavily before surgery, not because surgeons believed it dulled pain. Alcohol mostly does not, but because there was simply nothing else to offer. A drunk patient was slightly less likely to fight back. That was the entire medical strategy. Some surgeons tried opium. Poppy preparations had been used since ancient Egypt, and there are Mesopotamian tablets from around 2000 BC describing procedures that followed the patient drinking something. What exactly they drank and how much it helped is debated. The patients who survived rarely wrote detailed accounts. There were other attempts. Mandrake root was prepared as a soporific. Soporific sponges, cloths soaked in herbs including opium, henbane, and mandrake, were held under a patient's nose. Whether any of this made a meaningful difference is genuinely unclear. What surgeons could always do was restrain. Strong assistants held patients down. Leather straps held limbs in place. The screaming was considered unavoidable. Hospitals in the early 19th century scheduled operations in the morning while it was quiet, partly because the noise disturbed the recovery ward for hours afterwards. Some patients refused surgery entirely and died of conditions that were treatable. It was a rational calculation. The first real breakthrough came in 1842. Crawford Long, a doctor in Jefferson, Georgia, had noticed something at the social gatherings fashionable among young men of his time. At these so-called ether frolics, attendees inhaled ether for recreation, and the ones who stumbled and fell did not seem to feel the bruises. In March 1842, Long used ether to anesthetize a patient before removing a small cyst from his neck. Long did not publish his results. That left the credit open. In September 1846, a Boston dentist named William Morton demonstrated ether anesthesia publicly at Massachusetts General Hospital. The patient, a printer named Edward Abbott, had a tumor removed from his jaw. He sat through the entire operation without moving. When it was over, Abbott said he had felt nothing. The surgeon, John Collins Warren, turned to the crowd and said, "Gentlemen, this is no humbug." The news reached London within weeks. By December 1846, Robert Liston, the same surgeon of the 300% mortality, was using ether in his own theater. He performed the first operation under anesthesia in Britain on a young man named Frederick Churchill, who needed a leg amputated above the knee. Churchill was unconscious throughout. When he woke, he reportedly asked when the operation was going to start. Liston told him it was already finished. Liston called the technique a Yankee dodge and said it beat mesmerism hollow. He was right. Within a few years, ether and then chloroform had spread to operating theaters across Europe and North America. A procedure that had required leather restraints, multiple strong assistants, and extraordinary nerve on everyone's part now required a small bottle and a cloth. The speed race was over. Surgeons began taking their time. Precision, which had always come second to velocity, suddenly became the whole point. Nobody missed the old way. Now you know.